So hello, my name is Dr. Riccardo Vinciguerra. I work in the Royal Liverpool and Green University Hospital, and the topic of my talk will be the detection of a keratoconus with a new biomechanical index. So we all know that many cases of ectasia have been reported after LASIK, even if the patient had low risk scores on standard screening tests. But on the other hand, some patients with recognized ectatic risk factors remain stable. So how can we increase the sensibility of the test? There is a new theory, suggested by Cinzia Robert, that keratoconic corneas have a pathologic decrease of biomechanical properties, and this is the initiating event before changing the shape. So this will result in thinning over the weaker area, and this focal reduction will generate more deformation for the same road, which is a change in the shape, the curvature. So we will first have a change in the elastic modulus, then probably a keratoconus that is possible to diagnose with biomechanics, then with the change in the thickness and the posterior elevation, then in the change in the anterior elevation and curvature, so what we can evaluate with Placido topography, and then manifest to the slit lamp. So to further increase the capability of the Corvis, which is an instrument that is able to evaluate corneal biomechanics via a very ultra high split Scheimpflug camera, we developed a new combined biomechanical index that is called CBI. And this has been published in Journal of Refractive Surgery in late 2016. How did we create it? So we included more than 600 patients, included from 2 different centers in 2 different continents, particularly Milan and Rio de Janeiro, and these were healthy and keratoconic patients. The keratoconic patients had bilateral clear keratoconus with no previous ocular surgeries. The healthy patients had no other ocular surgeries or disease, no myopia more than 10 diopters, no concomitant or previous glaucoma or hypotonic therapies, and a Bailey Ambrosio of less than 1.6. And we decided this cutoff because we have seen that this has a very high sensitivity and specificity with a false negative of 1%. All the patients were also confirmed with the diagnosis by the other centers. So basically all the patients from Milan were confirmed from the staff of Rio de Janeiro, and the opposite from the Rio de Janeiro clinic. Corvic examination were all with good quality scores, captured with automatic release by same experienced technicians, and also a second manual frame-by-frame analysis was done by an independent mask examiner. Logistic regression was used to determine the optimal combination of the parameters and create the CBI. Then we used one dataset to create the parameter and the other one to validate and exclude overfitting, which is a very important concern in logistic regression. So the CBI, it includes all these parameters, but I will go through them one by one. Deflection and deformation amplitude ratio describes the ratio between the deformation, deflection amplitude at the apex, and the average deformation and deflection amplitude in the nasal and temporal zone from the center. So the greater is the difference between the central and the defined paracentral regions, the less resistant is the cornea to deformation. Therefore, we will expect softer corneas to deform more in the center rather than periphery, so with higher values of deformation amplitude ratio and deflection amplitude ratio. The standard deviation of highest concavity are relative to the correlation of deformation amplitude with BIOP, which is a new IOP estimate derived by finite element models. And this is taking out the influence of intraocular pressure of the measurement of biomechanics. The speed of a corneal apex at first and second ablation instead is named corneal velocity. Another important parameter including CBI is Ambrosio-relational thickness profile, which is a thickness profile in the temporal nasal direction. And this is the division between corneal thickness at the point, at the thinnest point, and the pachymetry progression index. So a lower value indicates a thinner cornea and or a faster thickness increase toward periphery. At last, the stiffness parameter is a new stiffness parameter that is defined as the resultant pressure. So it's the balance between the external pressure from the corvis and the intraocular pressure at first applanation. And this is all divided by displacement. So basically we are dividing a load over displacement, which is out of the plane stiffness. Let's go to the results. So this is a ROC curve, which is showing the separation between healthy and keratoconus. And this is in the training dataset with 98.2% correctly classified, with a sensibility of 94.1% and a specificity of 98.2%. But in the validation dataset, we even had better results with 98.8% correctly classified, with sensibility of 100% and a specificity of 98.4%. So this not only excluded overfitting, but also showed very comparable results. So in conclusion, to our knowledge, this was the first time that such an index, so an index based on biomechanics, was able to produce such an efficient separation. But let's see it into practice. So this was included in the Vinciguerra screening report that is included in the software of Corvis. So let's see a normal patient. So a normal patient would have, for example, any parameter that are supposed to stay in the normal ranges for the particular intraocular pressure measurement of the patient. On the right side, you will see the obtained results compared to the whole data set. And this, as you can see, fits inside the mean 2 standard deviation from the normal. In the bottom left, you can see the deformation and the shine fluke images. And in the bottom right, you see the absolute values and the standard deviation of deformation amplitude ratio, highest concavity, ambrosial relational thickness to the horizontal profile, and an oval stiffness parameter. In this patient, as you can see, all the measurements were fitting inside the normality values. Remember, I will go back, that the CBI has a cutoff of 0.5, and this is very important because in normal patients, this is normally way lower than 0.5. But let's see an abnormal patient. So as you can see here, it's clearly it's clear that all the parameters, deformation amplitude ratio, the ambrosial relational thickness profile, and stiffness parameter are outside normality values, and the CBI is 1, so it's much more than 0.5. If you want to know more about this paper, you can go online in Journal of Refractive Surgery, and you can download it for free, just looking for detection of keratoconus with a new combined biomechanical index. Thank you very much.